Ian, thank you so much for joining us. Annie and I are here to have a conversation with you that will be available on the From the Mentor's Desk podcast. And just to remind us all, our goal is to help early career and novice researchers seek and win their first and subsequent external grants so they can build the research career that they envision for themselves. So what we thought we would do is get to know you a little bit. We will link people to your proper bio so they can read all about it. And we wanted to hear a little bit about your personal journey. So could you tell us what's your sort of main field of scientific training and why did you pick that?
Yeah, great question. First, thank you for having me. It's a real pleasure to talk with you both about this. So I'm a clinical psychologist. I largely study the prevention of post-traumatic stress disorder and the prevention of suicide with a focus on military populations, although not exclusively with military populations. I got into the field partly intentionally, partly serendipity. When I was applying to clinical psychology PhD programs, you have to, look at the mentors who are out there, who's accepting students, who's not, what are the different program philosophies. And one mentor and program that really struck me, where I ended up going, the PI who I ended up being trained under was the director at the time of the Military Suicide Research Consortium, a very large DoD, Department of Defense funded initiative. And that's where I say it was a little bit serendipity, because by virtue of working in his lab, I then began a foray into DoD-funded work early on in graduate school.
So question, how did you decide to go to clinical psychology school in the first place?
Good question. In college, so I was a psychology major during undergraduate. Didn't know fully what I wanted to do. My roommates at the time, close friends of mine, they were all on the pre-med track and they were all doing labs. And it sounded fun. And so the nerd in me was like, I want to do a lab. What is a lab for a psychologist? And it was getting research experience and working as an undergraduate RA. And it kind of just snowballed from there. I had experience in a child psychology lab, realized working with children and understanding child development wasn't totally my jam. So then I transitioned to a geropsychology lab, and now I ended up a little bit more in the middle.
Fascinating. So clinical psychology PhD programs like you do are generally, you are licensed to provide clinical services, and yet most people who choose that path in your field are research bound. Is that correct?
Yeah, that's correct. The PhD in clinical psychology tends to be more research focused. The PsyD in clinical psychology tends to be a little more practice oriented.
So the healthcare piece, obviously, it's clinical, and you chose a program that happened to have a military medical research leader there.
Exactly.
So that's really great. Could you talk about the kinds of studies? You still appear, although highly accomplished, to be still fairly young in your life and in your career. So you haven't had 30 years to do research, but you've made great strides. Could you describe the kinds of research you've done so far?
Yeah, absolutely. It started in college. Kind of some of the more impactful research I got involved in was interventions to promote social connectedness among older adults. And so I did some work on that, and that was in the service of kind of connecting people and increasing connectedness as a suicide prevention intervention. And that got me interested in the field of suicide prevention, which is why I ended up applying to the lab I applied in. Early on in graduate school, I did a lot of work with firefighters and mental health. This was a serendipitous moment that I'm happy to get into, but and that was learning about repeated traumatic stress exposure and just like the difficulties of job-related stressors. And so did a lot of work with different firefighter organizations on trauma, on PTSD, on substance use, depression, sleep, you name it. And then that's kind of shaped some of my interest in then working with, although certainly not an overlap, some analogness, similarities with military populations. And So studies on PTSD prevention, studies on promoting secure storage practices for personally owned firearms as a suicide prevention public health measure, different digital health type studies, little dabble little here and there with all a cohesion under PTSD suicide prevention.
Right. Tell us a story about something that really inspired you in this way in the firefighters. It sounds like that was a formative time. It was also, sounds like you covered a lot of ground with that population.
Yeah, I think what in that work, I was very much at the time doing study after study, analysis after analysis without thinking so much about how can this research impact either clinical outcomes or policy outcomes. And then
sort of writing the papers, but not thinking it's going to do anything.
Exactly. A little robotically, maybe, which was helpful for honing scientific writing skills. And then kind of wild out of nowhere, about 2 years after one of our studies, we get contacted by folks in the Florida, where I went to graduate school, state legislature. And they're like, hey, we're working on introducing a bill for firefighter mental health. And we've cited this study in that bill. And like,
wow.
Like I was like, oh my God.
You read my paper?
I don't think people read those. But I think that was impactful in the sense that it was like, oh, like
real
this
people could do something about this.
research can be a driver of change. And that was cool. And
Did they pass it?
They did.
Ah.
Yeah, they did.
That's so exciting.
So your impact on policy like significantly predates your work with us.
I think there's a lot of things that impacted that, but it was really nice to see how they used research to inform some of their decisions.
So was that a spark at that time? You know, were you like, oh, okay, I want this to be a piece of the arc of everything I undertake? Or were you like, that was so random, I don't know why that happened. Like, how could I make that happen again? You know, how did you make sense of that experience?
Yeah, it's a good question. I think it was more the latter in the sense of it felt at the time like, oh, this is a one-off. This isn't going to happen again. You know, I was in graduate school and I had very little experience at the time. But I think ultimately as I progressed in my career, and then especially as I got involved more in DoD, military, Department of Defense work that is very kind of policy operational focused, with respect for the science aspect, of course. But I think at that point I realized like, oh, this is drawing from that experience a place I want to do research. And so it impacted me in that way, but a little delayed along the way.
No, I think it's great. Many people don't have that experience to ever tap into. They can't imagine a time when somebody is going to change policy or practice based on something they did. And so then you say you, again, with this mentor, were able to shift slightly into the military space.
Yes.
Can you tell us, so what in that portfolio are you most excited about right now?
Yeah, a lot of things. Okay. I'll mention a couple.
Yeah.
I think one thing that's very clear, there's been a lot of focus and for good measure on developing treatments for PTSD, people who have experienced traumatic exposures and then developed post-traumatic stress disorder.
Can we just pause for one quick second? Yes. Because I'm not a psychologist, but I know enough to be dangerous, and I know what PTSD is.
Yeah.
And people who listen to our podcast are interested in all different kinds of fields, and they're still learning. Could you just define a little bit about what that is and help us so we can make sense?
Yeah, no, thank you for flagging that. So PTSD, or post-traumatic stress disorder, it's a mental health condition that can develop for some people after exposure to a traumatic event, a car crash, physical assault, combat, sexual assault. Not everyone who's exposed to trauma develops symptoms of PTSD, nightmares, hypervigilance, other sleep problems, intrusive reminders of an event. But for those who do, and then kind of get really distressed and experience different impairments in their life, they might have PTSD.
So if something bad happens to you and you have bad dreams for a while and it goes away, that's not PTSD, right? PTSD is characterized by some of these symptoms over a period of time that impacts your life. Is that how we think about it, so we fully understand?
No, it's definitionally, it's if a certain set of symptoms persist for a month, at least a month following a traumatic exposure, and those symptoms cause really marked distress or impairment in school, relationships, work, what have you.
Got it. Okay, thank you. So you're shifting your research to PTSD in military populations. Is that often from being exposed to combat, or what's the environment, or is it just possibly being put at risk, but being put in harm's way? Like, in what ways do the military men and women that you study come into contact with PTSD?
Great question. Combat's one we think of often, and that's a big one. That's a big watershed moment in many people's lives. But all the other traumatic events that can happen in the civilian world or the non-military world affect military service members and their families as well. So my research covers that whole gamut of different traumatic exposures.
Okay. And so you're excited to study things that prevent or treat. Can you prevent PTSD?
Yeah, so that's a lot of the focus has been on treatment. And interestingly, the clinical practice guidelines, the document developed by the VA and the DoD, Veterans Affairs and Department of Defense, that kind of dictates like how should we treat PTSD and intervene with PTSD related topics. There's no psychotherapies shown yet to prevent PTSD. They're all treatment focused. And we have great treatments.
We do?
We have great treatments.
Okay. That's good to know.
Yeah. There's room for improvement and to make them more acceptable to folks. And we're working on some of those projects right now. But I think a big focus now and moving forward has really been on how do we prevent the onset of PTSD following traumatic exposure to begin with. And so you can imagine someone is in a motor vehicle accident, presents to the emergency department. It's not yet a month after the trauma. PTSD can't be diagnosed definitionally. There might be brief interventions that can be delivered kind of in vivo or at that moment to prevent the onset.
Thinking about, your entry and now developing your career in this military medicine space, did you have in the past, and do you have now, key mentors who helped you really shape and understand the problem in this area? Could you tell us about, what they do for you and how they've helped you grow?
Yeah, as a civilian, as someone who's not ever served in the military, is not currently serving in the military, I think relying on mentors is always a good idea as a researcher. A researcher interested in military medicine, there's an additional layer of mentors to have, right? You have your scientific mentors who help with the research aspect. The mentors that I really value, them for sure, and the mentors who are active duty themselves or are in military families and really get it and can check me and be like, Ian, that could be better. That research project and proposal could be better if you did it this way, because that will fit into our operations a little bit better. And so I can think of a host of mentors who have just helped me understand the context and the setting in which my research I want to ultimately impact practice and policies.
Yeah, it's like that cultural competency. Despite whichever population you're working with, you have to understand the cultural implications. And I think those military mentors really help.
Yes, absolutely. And the decision to have military mentors as active like co-investigators on grants was something my scientific mentors have also pushed me to have. And so I would say, gosh, I think all of my grants now and projects now have an active duty collaborator who's named on the proposal, who is just instrumental for the cultural competence.
That's interesting. I can imagine, that just sounds like it makes sense, right? From the like, does this make sense perspective?
Right.
Yeah, yes, exactly. It's just like, what? I hear some parallels with some people Annie and I have talked to earlier. We've talked to a number of, this is a day for PhDs, I believe, and, talked very, gratefully and passionately about clinician collaborators who help them understand the downstream effects and the context, and by making it bidirectional, they're happy. The scientists are happy to adapt. Their goal is to make a difference. There's many things they could study, right? If you say, well, do the variable this way or include this exposure, whatever, great, that's great. Because if I do it this way, now you have something you can use. And that is really the basis of like the movement to clinical and translational science.
Yes.
And I hadn't thought about active duty collaborators as part of that translational science paradigm. Actually, it's a beautiful example of it.
Yeah, definitely.
Do you hear that from people we've talked to?
I think it is something that Ian, I think, is rare in that he understands very early the importance of that. And so I think, especially from the academic side, there's a lot of career academic researchers who are hesitant because they don't necessarily see the value in it. And we
because
push
they
them.
focus just on the methods or whatever.
Yes, they're very focused
literature.
on the methods and what they perceive to be the outcome. And then when they start to go and gravitate toward DoD funding, they see that there is this huge, heavy emphasis on how do you translate this into impact for our population. And you have to lay out your plan very clearly. And so you can't do that if you don't understand how the military implements change or how the military implements clinical care, because it's different. And so I think early on they'll start to see the value, and we, from the Combat Center, one of the things we do is we match them with an active duty researcher, usually clinical researcher, and they just form that partnership to really, and I think I've never seen somebody come back and say that wasn't worth it. Or I didn't need that person. It's usually like, can I get another person? Can I get Mike and John? Can I get Mike, John, and Steve? So I think the value is very evident after that initial hurdle.
Right. So the wanting, for the knowing, and then the wanting,
Yes.
and then the being required to do it whether you want or not.
Yeah.
But you sort of answered a question that I had, which is, supposing your mentor says, Ian, you must, like, this is a must-do thing. Where the heck would you find this magical active duty collaborator? And you, Annie, because of your role in the Center for Combat Research, say, call us. We will help you. We're the ultimate mentoring hub to help connect you to people. And you were doing this work before you knew the Combat Center. So how for the people listening to this podcast, of course, we'd say, call Ian, call Annie. Or what are some alternatives? How would people find these collaborators?
Yeah, well, I want to underscore the Combat Center for Combat Research propelled in new directions the connections within the military for me. And so I was doing it before, and it's qualitatively different now in such a wonderful way.
Say how.
In the sense of recognition that not every service does something the same way. The Air Force is different than the Navy. They have different operational needs. And I think I used to think of it potentially more as a monolith, like, oh, you're in the military or not. And some of the work I do is around firearm injury prevention, firearm suicide prevention. And I used to make an assumption that if you're in the military, you know about firearms, because that's what we see on TV, that's what we read in books. And that's not the case. Not everyone gets the same training or trained at all. But to your question about before that, it really is leaning on other mentors. I can think of a early formidable experience where Thomas, my PhD advisor in graduate school, was doing grand rounds at a big Navy installation, Navy Medical Center.
Okay.
And he's like, Ian, you want to come with me? And I was like, yeah. Meeting people there wasn't necessarily the connections that then I'm working with now, but it was exposure to settings and populations and people to realize, like, oh, there's these people in these settings to then reach out to. And then it was really just engaging networks. And so part of that is having to, there's a level of serendipity and luck. Do you have the right mentors? But there's also a opportunity to cold email people and just express passion and, say, I've read you do this, this, or this. I want to do this, this, or this. What advice do you have? And it's not uncommon. We can fold someone in and say, oh, you should meet this person. And then it snowballs from there.
That's great advice. Whenever I send mentees out to meet people, often, if we have like newly recruited researchers and we're going to train them, I actually give them weekly homework. And the homework is you must meet one new person a week minimum. And I'll give you a list to start with. But then your job is every time you have it's sort of like I've read, do your homework. Who's this person? Why are you here? And then a little bit about you. And then say, well, to have a conversation, don't agree to anything. And then you say, knowing a little bit about me now, I'm new to campus, what I'm looking for, who else should I meet?
I remember you giving me that advice.
And then you snowball and you meet all the cool people and you learn the connections too.
No, it's wonderful. And I've yet to come across someone who, sure, maybe you don't get a response every time, but I've yet to come across someone who's like, I don't know why you reached out to me. Don't do that. It's always positive or neutral.
Yes, good. Your story about going to your mentor's grand rounds at a naval institution, it makes me think, I have gotten to know some military-based active duty researchers over the years working with the Combat Research Center. And one thing that struck me is some of the same challenges that you've described that other people have too, trying to start your research in military relevant topics. I think I saw some of those people have similar struggles when they need civilian collaborators. Their group, just like us, no one department or school or even university will have everybody you need. Maybe there's the one Dr. Fabulous who's somewhere else. So you have to look outside, and many of them really are in need of academic partners, and they don't quite know who to talk to. And some of them go back to, well, I did go to undergrad wherever, and they, it's okay, but it's not like the perfect mentor or collaborator, and it's not the ultra connector that the Combat Research Center serves. Just to, do a little PR for the department, but it is a network of people who are everybody's far less than 6 degrees of separation, right? And part of the game is, let me tell you who I am and what I'm doing, like help me find the right people. And you say, oh, I'll open my Rolodex to you, so to speak.
Right.
And it helps.
Yeah, it helps. And I think in many ways, people in this field are in it for common reasons, that you can find a level of commonality that creates this culture of togetherness that like, hey, I'm flattered you reached out to me and I want to help you, but I also want to help you because we have this larger mission, and the more people to kind of get at that larger mission, the better.
I think that's a really important point, that in the military research space, I have never met someone who is not altruistic. And so it's never, I want to do that first. It's never, I want to figure this problem out first. I want to do it better than you. It is, oh, you're looking at the same problem I have. How do we do it better together? Whereas I think sometimes there's a little bit more competition on the academic side. And so there is that sense of competition to do better and be better, but it's how does our field be better? How do we progress better? It's never you against me or us against them.
Yeah, I see that too. It's almost like that shared why, right? You want to make a difference. There are lives at stake, right? Like there's an urgency, and I agree. Having been a lifetime academic, this is this wonderful oasis of like true collaboration that you really don't see in other places where things are competitive. There are limited grant funds, like only one person's going to get the lead. But there's a real ethos of let's work together in this space that I find very rewarding.
Very rewarding. And as you know, as an early career researcher, I think helpful too, because I mean, one, there's like a culture change element in that socialization, but two, what it means is that there's people willing to, you know, as Dr. Flaherty, the center deputy director, says, like, all boats rise when you mentor left, right, up, down. And that's really helpful for an early career faculty member as well.
That's wonderful. Thank you so much.